Hello, everyone. Thank you for joining us for another one of our video chats here today. Before we get started, I just want to take a minute up top to recognize what's happening out in the world right now. We have all watched over this past week as some of our fellow Americans have stood up and said enough is enough. The chamber released a statement yesterday, if you haven't seen it, recommitting to the fight against inequality wherever it shows itself. There's some concrete steps within that statement, so I'll just refer you guys back to that. There will be some community forums as well as the Diversify event coming up on June 19th that will hopefully help address some of those issues. But for today, we are going to be talking with Dr. Marc Cromie and Dr. Todd Levin of the Chattanooga Allergy Clinic about how to recognize the difference between allergy symptoms and COVID-19. As an allergy sufferer myself, I can tell you when it hits, it can hit pretty hard. So want to welcome both of them. As always, we'll have the Q&A up from the beginning. If you have questions, feel free to drop them in there, and we'll circle back to them at the end. Welcome, doctors. Thank you for being here.
Oh, thanks for having us. All right.
Absolutely.
We're excited to be here today. We're going to start with some slides that we'll go through, and then we're going to answer questions from you guys regarding allergies, spring, summer, fall, COVID, etc.
Okay.
So, all right. Here we go. Now, as you guys know, Chattanooga is one of the worst towns in the United States when it comes to spring allergy suffering. And the only thing that gets more press in March and April this year than allergies has been the COVID and coronavirus. So it has affected dramatically us, our patients, etc. And so we want to talk about how you can tell the difference. First of all, I want to give you a little background into what is an allergist. So people go, I went to see this allergist, and they're like, well, what is an allergist? All right, so to become an allergist, you have to be double boarded in either pediatric or internal medicine. Now, Dr. Levin and I did very similar training. We both went on after med school. First of all, we went to University of Georgia, then we went to Medical College of Georgia, and then we both did pediatric residency at Children's Hospital here in Chattanooga. So the first step of becoming an allergist is you have to be board certified and do a residency in either pediatrics or adult medicine. So we did peds because most allergies start in childhood. Eczema, hay fever, food allergies, those are all childhood diseases. So we wanted to start early in our treatment of our patients. Then after a pediatric residency, you move on and do an allergy fellowship. And that's a 2-year fellowship where you are trained in pediatric and adult allergy, asthma, and immunology. So a lot of people don't appreciate the fact that not only are we allergists, but we're immunologists. So as you know, the most famous immunologist that everybody loves is old Dr. Fauci. He is an immunologist. And matter of fact, his department, it even has the word allergy in it. So I love seeing him on TV. So after our allergy fellowship, I came back to Chattanooga Allergy Clinic in 2000 to join. And then Dr. Levin, who was a pediatric resident at the time, came through the office and trained with me and loved Chattanooga also. And I was able to talk him into coming back and joining us in 2006. And then after him, we've had several other. We got Dr. Perry that came in a couple of years later, Dr. Patel, and now a new Dr. Van Mason coming in. So with Dr. Kaplan and us, we have 15 providers. We have 11 or 10 nurse practitioners, and we have 9 offices. So we're all over Chattanooga, North Georgia, Dalton, Cleveland, Ray County, Jasper, Kimball. So we are here to serve the community, to get people on the road to recovery, so to speak. So that is just a background of what an allergist is, because a lot of people don't really know what allergists are. They know what allergists treat, but not exactly how they're trained. So next slide. As I alluded to, we are known for having some of the worst allergy seasons in the country. We are just finishing up the tree pollen season, and we are actually in transition phase between the trees of the spring and the grasses of the summer. Now, this is a combo for patients that's devastating if you are a severe allergic patient or if you have asthma, because these symptoms can definitely cause a gamut of symptoms that will knock you on your back. And so with Chattanooga residents suffering from allergies, coughing, runny nose, feeling rotten. The question is this allergies or is it COVID? And that's what we're going to try to teach the difference of. All right, so I'm going to let Dr. Levin talk about allergies for a second. On this slide, Todd, you can take over.
Yeah.
Flip side.
Oh, yeah. So allergies are definitely something that's a really big deal in Chattanooga. We live in this giant bowl, and all this pollen just sinks down to the bottom of it, and it makes us miserable all the time. But particularly in the springtime, we have tree pollen, and then we're heading into grass pollen season. And the biggest trouble during this time of year is nasal congestion. We have drainage on the back of the throat that makes people clear their throat, sneezing, itchy, watery eyes, and this cough. The problem with allergies is it just wears on you over time, and it affects your sleep quality. So if you can't sleep, you're going to feel bad, and you're not going to be able to do everything that you want to do. It's going to affect you at work. Even if you're able to go to work, you're not able to be as effective at work, and that's called presenteeism. So absenteeism means you're missing work because you're so sick, but presenteeism, you're able to make it to work, you're just not all the way there. Oftentimes our patients with allergies will also develop loss of smell and taste, and that's more of a long-lasting issue for them. Paying attention to when your symptoms get worse is super important, but at Chattanooga Allergy Clinic, we're able to actually test you to find out exactly what you're allergic to, so we can actually predict when your symptoms are going to peak, and you can start treating the symptoms ahead of time. So that's super important. If you know that you're allergic to tree pollen, you're going to want to start taking your medicines for sure in February before the tree pollen season hits.
Okay, so now, what is COVID? Well, everybody by now is familiar with this devastating silent enemy that we've been dealing with. Fever is obviously a cardinal symptom for this. Difficulty breathing, this is where it gets confusing. If you're an asthmatic, patients that will have asthma, obviously one of the symptoms is cough, shortness of breath, tight chest, and wheezing. So a lot of patients with COVID will have that. They'll also have dry cough. As Todd alluded to, allergies can cause anosmia or loss of smell. Well, this is one of the weird symptoms that we've noted, particularly from the ENT specialists. The patients that have COVID also have a loss of smell or taste. But of course, like most flu-like illnesses, patients will feel like they've been hit by a truck. They have muscle aches, pain, fatigue to the point where they really can't get out of bed. I mean, the difference is hay fever or allergies, you don't really have a fever. With this, you're going to have a fever. You're going to feel sick in most cases. Now, there are some subtle signs. There are patients that the problem with this is that they are asymptomatic spreaders. So they are contagious, but they don't feel like they've been hit by a truck like most people that have flu. And so unfortunately, we're having a bunch of COVID-19 cases because they're being spread by patients that don't even know they're sick. But some people are having not only the classic symptoms, but also the GI symptoms, nausea, vomiting, and diarrhea. But as I mentioned before, the difference is allergies do not cause a fever. They typically don't make you have aches and pains or GI symptoms. The common symptoms that they have can be cough and congestion, loss of smell.
All right, we can move on to how we test both allergies and coronavirus 19. For allergies, there are several different ways of testing, but the best way to test, they call it a skin test or a scratch test. Basically, what we do is take tiny little droplets of what you might be allergic to and just barely scratch the skin. And within 15 minutes, we have the results. This is the gold standard of testing for allergies. We get the results faster. It's the most accurate testing that we have. You can see this particular patient has several very large swells. Sometimes it's not this noticeable, but our excellently trained nurses are able to tell exactly what's going on, and it helps us make an accurate diagnosis the first time we see the patient. If for whatever reason we're not able to skin test, we can do a blood test. These tests typically take between 3 and 7 days to get back. They're typically a little bit more expensive, and they're not quite as accurate as a skin test.
All right, so with COVID-19 testing, and Dr. Levin can add some to this. He's kind of our COVID-19 specialist. But the CDC recommends a nasopharyngeal swab. And basically, they will stick the swab on both sides of the nose, and it's very uncomfortable. Although it says it doesn't hurt, it's uncomfortable. I've had one done at the beginning of this just to make sure I didn't have it, because I thought I had the flu, but my flu test was negative. My COVID test was also negative. And 24 hours I was better, so obviously I didn't have this. But when I had the test, I can tell you it's a little uncomfortable. But now there's also some blood tests that can be done, antibody testings that look for IgG, meaning that you've been exposed and you have protection against COVID-19. IgM would indicate that you actually have an acute or active infection with it. So there are some blood tests that are also available that are out there now. I didn't know if there's anything else, Todd, you want to mention about this slide.
Yeah, no, the nasopharyngeal swab is the more accurate test for diagnosing an acute infection. Still, some of the rapid tests have some false negatives. Really, it depends on the technique of the person doing the test and the technique of the lab technician themselves. The Abbott test, or the 10 to 15 minute test, if it's done correctly, has very low false negative rate, but it's actually a technically demanding test. So if it's not done correctly, those numbers can increase. As far as the blood tests go, the IgG test and IgM test that Dr. Cromie talked about, depending on which lab is done, we may be picking up other coronaviruses. Certainly there are many coronaviruses that circulate in our community, and if we don't get a specific test, it may not mean anything. The other thing is, at this point, I don't see a huge point for the IgG testing. We don't know yet if having the disease in the past protects you in the future. We think it probably does, but we don't know for how long. So for one individual person, a patient, it may not make a difference, but looking at communities to see how close we are getting to herd immunity, it may be useful in the future.
Now, Todd, do you want to mention a little about what we can do to avoid this? I mean, masks, washing hands, etc.
Absolutely, yes. I think there are some very easy, simple steps that we can take to decrease the spread of COVID-19. Like you said, wearing a mask. There's a study that just came out recently that showed that wearing a mask decreases spread by about 85%. So if everyone is wearing a mask, that will make a big difference. So staying socially distant to other people, trying not to get in people's personal space. The current recommendation is about 6 feet. Although that being said, if someone sneezes or coughs, these droplets may spread a good bit farther than that. That's the point of wearing a mask, because it slows down that the distance that the droplets can go. Frequent hand washing and making sure you don't touch your face. The data that I look at, there's a statistical analysis called R naught. It's an R with a 0, and that just measures the number of infections that one person is responsible for. So if someone gets sick, how many people do they spread it to? That, I think, is the most important thing, and we can actually modify that by our behavior. So anything we do to decrease the number of people that get it is important. So if you're starting to feel sick, you should get tested, and you should automatically isolate yourself until you get your test results back. You should stay away from your family. You should stay away from your friends. Wearing a mask, if you can decrease the amount of viral particles that are spread out around you, it decreases the amount that other people are breathing in. So the masks are not so much to protect ourselves, but to protect the people that are around us, the people we love. And washing our hands, and the virus, requires approximately several hundred to 1,000 copies of the virus to have a good infection. So if we can decrease the amount of exposure, we can decrease our infections.
And what we're trying to do at the Chattanooga Allergy Clinic, obviously, during this pandemic, it was the peak of pollen season. We're seeing 400 to 500 patients a day for allergy shots. In all 9 offices, we're seeing thousands of patients a week. So obviously, we had a significant reduction at that time. Now business is back to normal. But what we're doing is carefully screening the patients at the door. We're checking temperatures. Every patient that comes in, if they don't have a mask, we're giving them a mask. And then our shot room is still rolling, because people that are on allergy shots, basically, we're training their immune system to quit overreacting to the tree pollens in the spring and their dog and the cat that they love. So they need injections about every once a week or every 2 weeks once they get on maintenance. So these patients know if they don't get them, that their symptoms start to come back. And so typically we've had patients continuing to come in to get their allergy shots. They're in and out quickly. And so we are still able to see patients in a controlled, safe environment despite this pandemic that's going on. So we have some questions probably right now, Jeremy, right?
Yes, absolutely. So it sounds to me like with everything you all are recommending, so if someone is, sitting at home debating, is this allergies or is this COVID? It sounds like your advice is, first of all, don't go to work, correct? And then
Correct.
perhaps contact a doctor.
The current recommendation is, if you're concerned for coronavirus, is to either contact your primary care doctor or the health department. The health department has believe free testing available at multiple locations, and the results come back pretty quickly. I believe that most of the testing is brought to the Baylor School's lab, and it's done very quickly. You get the results really quickly. But yes, if there's any concern at all, if you're not feeling right, because this disease is strange. It can make people very, very sick. You can have very mild illness, and you can be an asymptomatic carrier. And the last thing you want to do is spread it around. It seems, for whatever reason, certain people are more prone to spreading, and we don't have a good grasp on who are these super spreaders and how to prevent those super spreading events. And that's really what's driving the spread of the disease.
And Jeremy, if these patients aren't having fever and they're not aching and feeling rotten, but they've got just a runny nose, a drip, or they get around a particular allergy, start sneezing and itching, or if they have underlying asthma that's becoming intolerant or becoming exacerbated, and antihistamines and over-the-counter medications for allergies help, that's not going to help corona. So in those cases, they probably have more of an allergic component than this viral component. And in that case, those are the patients that can easily be screened at the Chattanooga Allergy Clinic to find out for sure what they're sensitive to. Because as you saw in that skin testing earlier, we can specifically figure out what is your trigger, and then we can give you a route of avoidance measures, medications, and immunotherapy or allergy shots, which can change the course of this disease. That's the thing about allergy shots that people often don't understand. The insurance companies usually cover them because they look at it as preventative therapy. We're giving you an injection of what you're allergic to, slowly building up the dose, almost like a vaccine approach, okay? We're giving you something that teaches your immune system to quit overreacting to stuff you can't avoid. If you live in Chattanooga, you can't live in a bubble. So by giving you these allergy shots, we can change your immune system, reduce the need for medications, prevent asthma by at least 50% if you start these allergy shots in childhood. And in 5 years, you're done. So there is disease modification. It's the closest thing we have to a cure. And people just get tired of taking a 24-hour Band-Aid called Claritin.
Sure, absolutely. You guys mentioned that we're moving out of spring and into the summer right now. That means different allergens, right?
Yes, sir. We have different pollens in the summer than we do in the spring. This is more of a grass season. We also are seeing some molds out with the rain. But the other thing that I'll let Dr. Levin talk about is the perils of the patio. And what I mean by that is Hymenoptera sensitivity.
Absolutely. So we're starting to see, as the weather has warmed up, we're starting to see more and more flying insects, bees, wasps, hornets. And given how much time we all spend inside during our quarantine time, we're trying to get out more now, and the stinging insects are out, and we see quite a bit of people that could have potentially life-threatening reactions to these things. The good news is that Chattanooga Allergy Clinic, we can actually test to find out if you're allergic to bees and wasps, and if you are, we can put you on venom immunotherapy or venom allergy shots that decrease your risk of having a severe reaction by 97%.
So it's huge. It's going from potentially dying every time you get stung to just making it go away. And it's
You
beautiful.
just get a local reaction, a normal sting, instead of breaking out in hives, having your throat swell. It's quite powerful.
Well, and there's a little bit of a catch-22 here, right? Because we have some evidence, it sounds like, that while it certainly doesn't protect you 100%, it seems like it's a little harder to spread the virus outdoors. But that's where the pollen and the allergens are.
Yeah, so we don't know exactly how the weather affects the virus, but yes, you're correct. It does not respond as well to heat and humidity, which we have here in spades.
Sure.
It just makes it more important to make sure we maintain appropriate distances, even in that humidity, just because we just don't know yet. There's a lot of unsettled science out there, but all the best minds in medicine are looking into it, and we'll know more as the summer goes along, even this year. But as you know, there doesn't seem to be any way to get rid of this virus. It's going to be with us for a long time, even if we get a vaccine. We'll learn more and more about how it acts, and we'll be able to make predictions about that, like we are able to make predictions about allergies.
Well, and that raises a good point that I think I've heard from a few different doctors now. That people need to realize this won't really be over the way that we want it to be until there's a vaccine, right?
That's exactly right. And we're really going for herd immunity, and the only way to get herd immunity rapidly is a vaccine. Unfortunately, letting it spread through the community is a much slower process, a more dangerous process. Certainly, there will be people that are negatively affected and even die with that process. So we want to slow that spread as much as possible and give our scientists a chance to develop a vaccine. Dr. Fauci, the most famous allergist in America, has said that we're likely to have at least one of...
Is he more famous than us, Todd?
Well, I mean, the second most famous. The second most famous.
Okay, now he is. Go ahead, sorry.
He's the third best looking allergist in I don't know.
And the shortest out of the three of us.
I don't know. I'm pretty short. But we should have a vaccine most likely by December. We're crossing our fingers for that, but there are dozens of promising candidates out there. And if at least one or two of those work and we can get them to market at a record rate, which is we're on target for, it's a game changer for this disease.
Okay. Anything else you want to leave folks with before we wrap up here?
Well, on a note of optimism, I hope that eventually we'll get this COVID under control, or as Todd alluded to, get a vaccine, and America will once again go back to normal. But here's the thing. The allergies will always come back. So operators are standing by for your call now. Chattanooga Allergy Clinic, okay? From the womb to the tomb, all ages, 9 offices to serve you. If you don't want to suffer next year, come in and see us now. Get on the regimen, find out what you're allergic to. And immunotherapy or allergy shots is a game changer and can make a difference long term.
Excellent. And I'll back that up as a patient. I'm not only a subscriber, I'm also a user, right? Allergies can definitely make your life miserable. So getting those treated is a way to help. for sure. Thank you both. Dr. Levine, anything else you wanted to add before we go?
No, I appreciate you having us on, and I just want people to, be careful out there. It's a jungle out there. We're really good at treating allergies, and we're getting better at treating coronavirus.
Excellent. Thank you both so much.
Thank
Thank
you.
you.